Welcome to another course on workforce planning. Quite excited because this is actually course C, a new course on what we're calling a WRAPT plan. This is really a course on how to develop a workforce plan or workforce strategy. We'll discuss the similarities and difference on this course. There are two main sessions in this course. Session 1, which is about how to develop the plan, and then the second one is more detail on what a plan actually is. Before we start though, let's explain who I am and who we are. My name is Colin Lurie. I run Carados, which is a management training and development company, focus on building skills in frontline health and care managers in all sorts of topics, but workforce planning runs through quite a lot of those topics. We do it in a way that includes providing free tools and techniques, which also includes the WRAPT tool itself, which is an online, free-to-use, secure workforce modelling tool, which is run by these guys. I'm the director of the WRAPT service, which is based at based at Lancashire and South Cumbria NHS Foundation Trust, funded and commissioned by Health Education England. And as a team, we use the tool and we use approaches to take you through various steps to undertake workforce planning and to address the workforce challenges that you have got. So that's us. This is how we do it, and it's important, so important that we cover this on every course, because the provision of free tools and techniques like WRAPT, like these courses, is only part of it. You have to bring some capacity and capability to be able to do this training. It takes time, even just to do it, but what also takes time is that you really need a reason to learn and a chance to practice something. So you need to actually be doing a project, and undertaking a workforce planning project can take a lot of time, and if it's going to take a lot of time, you need to make sure you've got the support of your organisation or your system. So all in all, as well as providing these free tools, you need to provide the capacity. You need to link with your organisation to make sure that they agree that the project that you're going to do is a good use of your time, and that they're going to give you the time and space to do it. Otherwise, just going through these courses is not going to do you a vast amount of good. But having said that, let's get on to the course and take you through what's in it. So this one fits within the workforce planning set of courses, and this one here is about how to develop a workforce plan. There are other courses on what it is, how to redesign it, which is a very big course, how to use the WRAPT tool, the features of a workforce hub, and some stuff on frontline workforce planning. This one's about how to develop a workforce hub, and like I say, this will be developing the plan, and then what a workforce plan looks like will be the next one. In this one, what we're going to cover is what the elements of a successful plan are, what a plan is, and then we'll take you through a few key things that you need to know when developing a plan. We'll take you through an approach, some tips on engagement, some thoughts around reviewing documentation, and then future state planning. But we'll end with a single approach to developing a workforce plan, which is a very packed slide, but is one which should give you a single page on how to go about developing a workforce plan. So that's why we are here. If you've done the WRAPT Redesign course, you'll recognise these 5 circles, all the way from scope and mobilise through understanding the current state to developing the future state to modelling the future state and to implementation. This as an approach is a great approach to redesigning workforce, but it is also a great approach to take to planning or to developing a plan, because it's a fairly standard improvement set of steps, and you can learn a lot from it. So if you have done the WRAPT Redesign course, a key thing to think about is how can you apply what you've learned in that course to developing a workforce strategy, because in many ways it's the same thing. So you need to have a proper project at the start. You need to be able to mobilise it properly. You need to get the right people in a room. You need to understand when it needs to be done by, etc. You need to understand the current state. You need to develop the future state, and then you need to model and plan and implement the difference between the current and the future state. So it's no different to a redesign program, the WRAPT plan program. But there are things that you need to consider, and very specific things to consider, which we will go through. But I don't want to leave this slide too quickly or too soon. It is worth remembering that any of these individual elements will be important. So when you're understanding the current state, engaging the stakeholders we will talk about, the need to review documents we'll need to talk about, you are going to need to pull data together. You are going to need to analyse that data, and you're going to need to write it down. And then when it comes into developing the future state, you are going to need to engage staff and users in what they think the future state should look like. You are going to have to align that to the challenge you've been given. You are going to have to model it in some way. Modelling not a major piece, but you're going to have to model it in some way. And then you are going to have to, within that strategy, have a case for change, which will be partly driven by the benefits realisation. You are going to need to document your governance and your new plan and your communications plan, all of which are in the plan actions section. So it is going to be vital that you follow this process. And so if you're doing WRAPT plan, it's not a bad idea to go back and do the WRAPT redesign course if you haven't done it. Right, moving on. Let's think about some specific things. Let's assume you've done that, and I've got the wrong title on this slide. It is this. Let's move into a view on how to do a proper workforce plan or strategy. Before we start, I just want to talk about a successful plan. And you might have heard me go through this before, but one of the key things I like to think about is the making sure that this plan really lands properly. So there's a few things we need to think about. First thing is speed. How quickly is this plan needed? If we have got to get a plan in place very quickly, then that means we're going to have to do a very quick and dirty plan. If we've got plenty of time, then fine. We just need to think through how we can go through a full engagement process. But we do need to understand how fast we need to do it. We need to understand the scale of it. How big does it need to be? Is this just a tweak, or are we going to go for massive amounts of transformation? That is going to be needed before we come up with a plan overall. And linked to that, we need to know what the scale of the financial saving is. There is no point in if financial savings are needed, or if there's quality improvements needed, what the scale of that is. It's just, I must admit, most of these I've done have been linked to finance in some way. There's no point in developing a plan that will not meet the requirements because it won't get implemented. We need to know, is it actually possible? Is this something that can be done? We need to think about that all the way through. Is it going to be possible to come up with a workforce plan engaging a group of people to meet the level of savings required? Or is this something that's going to need to be imposed because there's no way people are going to agree on it? There's no point doing a workforce plan and engage lots of people if this is something which is going to need to be done centrally because of its complete lack of popularity or whatever else. But we do need to understand, is it possible? And then whenever you're developing a plan, always use the excellent Minto approach, which is part of the Minto approach. Minto is far greater than this, but one of the things which I pick out from it is really trying to think about what are the three things we need to focus on. What big things are we going to deliver through this plan that we're going to hang everything else on? It's far better to be able to deliver three things than try to deliver 100 other things and not do it well. Those three things will be better implemented, but they will also be easier to engage people around. So you might wonder why there's a picture of a dinosaur on the left-hand side and where I skipped where can we get investment. But where can we get investment is the single most important thing, I think, about developing a successful plan and strategy. If you've seen the film Jurassic World, there is a point at which a character, Gray, is involved in a fight. There are two dinosaurs fighting, a big baddie dinosaur and a small goody dinosaur. It gets a bit complicated as to how that's arisen, but that's what's going on. And the character Gray identifies that we need more teeth. We're losing the battle. The battle's being lost because we don't have enough teeth. At this point, this triggers one of the characters to go off and release a Tyrannosaurus Rex, which for some reason helps out the goody dinosaurs, and all is good in the end. I didn't say it entirely made sense, but it's thoroughly spectacular, and it makes my point that they won that battle because they brought in more teeth. Well, why is that relevant? Well, for me, it's always relevant, is that the more resources you can bring to bear quickly on a project, the more chance it has of succeeding. So for a plan to succeed, you are going to need money, you're going to need people, you're going to need time, you're going to need executive engagement. The way you get that is by making sure that the plan gets the right investment you need and hits the needs of the executive. So I've spent a lot of time on this again, but the reason is that it's important to make sure that before you even start the planning, you can win or lose by really asking yourselves these questions up front. What is a plan? Well, in reality, it's only got 4 sections. It has got a background, so it's a little bit of kind of bit of background as to why, a bit of context. There's a bit of a view on where we are, the current state. There's a bit of a view on where we want to be, the future state, and there's a bit on how do we want to get there, which is the difference between how do we get there, which is the difference between how do we move from the current to the future state. That's all a plan is. That's all it needs to be at the absolute basic. We'll talk, say, in the next course about all the individual elements of that might be included, but that is all you really need. Are those 4 elements. One thing to remember as well is that difference between a workforce plan or a workforce strategy, we'll cover it again next time, but in reality, a workforce plan and strategy could be considered to be the same thing. For me, a strategy tends to be a more engaging and high-level document, normally setting out some key elements that we're going to undertake, the overall direction that we're going to take, whereas a workforce plan is a more detailed document which tells everybody exactly how we are going to do it. So when I talk about strategy or plan, they tend to merge together in these conversations that I have. And you can pick whichever level you want, just purely strategic with very high level stuff or very detailed plan stuff. It's entirely up to you where you fit things. I'm not going to go through this now. This is where we're going to end up. But I just want to flag that there is an overall approach summary that you can follow, which does take you through the steps from mobilize to interviews to document review, some data analysis, into some workshops that will then help you to develop a plan that you can then document and then validate. So we have included a sort of a step-by-step like this, which we'll talk about at the end, but we'll be going through this, or elements of this, as we go through. So, developing the plan. Now, if I asked you to come up with a workforce plan for an ICS, an integrated care system, in an hour, you could probably do it if you knew the ICS. So if you were a workforce lead for that ICS, you've been working there for a while, you could probably come up with a plan. People would say, no, you can't do it. Well, yes, you can. At the end of the day, the quality of a plan, the cost of a plan, the time of a plan are 3 different elements. And any one of those elements can be driven very hard at the expense of the other 2. So if you have no time and you have no money for it, then you can produce a plan. It's just be a very, very low quality. If you have an indeterminate amount of time or a very long amount of time, like 6 months to develop a plan, and you've got hundreds of thousands of pounds at your disposal to develop that plan, the quality of that plan can be considerably increased. And the factors of that will be through having more people doing data analysis, more people doing engagement, more people engaged, nicer designs, etc. If you're asking someone to develop, one person to develop a plan in an hour, it will be that person's view, and it will be scribbled or written very quickly in Word over a couple of pages. If you engage more time and more cost, you may end up with a much larger document with many more people engaged, and therefore a much higher quality plan in all respects. But always think about what quality, what level do you want to do, and never think that you can't do a plan in whatever time scale you're given, because you can do. It's just the quality that gets impacted. Obviously, quality at some point drops below a level which is acceptable. but it can also go very, very far above a level that's acceptable. One of the key things that we like to do is to get people to do enough data analysis to be what we call a minimum case for change. One of my previous bosses at a company called Finamore used to use that phrase all the time, and that minimum case for change is the optimum amount of data analysis you can do to convince people to change. You can overdo data analysis quite easily. So developing the plan can be done in that way. Now, so I showed you the approach when we went through things at the start, and I probably should have talked about it here rather than there. But when you are going through this, as I've said, this is the approach that you take. So you are going to scope and mobilise. You are going to do that properly. You are going to make sure that you have the governance, the project charter, the stakeholder engagement, and all of that stuff. You're going to plan for all of that at the mobilisation stage. You are going to do a current state. It's going to be on a larger scale than you did for the redesign. It's going to be less detailed, but it's going to be larger. Developing the future state is going to use similar engagement techniques, probably on a much larger scale than if you developed a plan for an individual service. If you developed a redesign for an individual service, sorry. You're going to model the future state. As I said, it won't be as granular, but it's still a key part. And then really where things come in is the implementation bit, because you are going to need to make sure that you've got a business case and a benefits realisation plan and an action plan and communication strategies all sorted out. So, as I said, this approach is still the one to take as we go through it, as we each of these steps. But there's a few specifics for the project we probably need to think about. And the first one is engagement. So, if you are going to develop a workforce plan for an ICS or an ICP or even for an organisation, but I'm going to talk mainly about ICSs, the Integrated Care Systems, you are going to use workshops, assuming you have enough time. I'm a big fan of these when you're developing a plan. It's a great way of engaging lots of people very quickly. And it's important that we do, and it is important that we engage a lot of people for the 4 reasons set out on the left hand side. If you were to do stuff on your own, then you wouldn't have enough expertise. If you ask lots of people, people know the issues. So whatever you know, but if you ask 100 people or 1,000 people across a system, you're going to get a lot more expertise and a lot more teeth targeted at the problem. So you do need to make sure you engage people to get their expertise, obviously. Another thing it allows you to do is to develop themes. And if you're developing themes, you're able to assess the weight of things by talking to people. So you might list out, what are the issues, but if you ask a lot of people, you're able to identify from a qualitative point of view what are the areas that most people are worried about, what are the areas that most people think are issues, which allows you to bring things together into big themes, which you need to deliver. If you do it yourself, again, you'll be picking out your own things that you think are most important. If you're talking to people through this process, one thing it allows you to do is to reflect back to people in the plan what you haven't addressed in the plan. If you don't engage people and you don't include something in the plan, people will go, oh, well, it's missed this. Well, actually, you haven't missed it. You have discounted it for a specific reason because it's not priority or because the data didn't back it up. So if you ask people what their issues are, they tell you, and you don't address them, you are able to reflect them and therefore make sure people don't feel like things have been missed out. So that's an important thing. And then finally, and a slightly more, I suppose, not quite Machiavellian way of thinking about it, but one thing you do need to think about is the more you engage people, the less chance you give people to say, well, this is rubbish because you didn't think about this, or you didn't think about that, or you didn't ask me. The better you engage, the more people you ask, the less easy it is for the blockers and the downright obstructors to stop you from getting a plan through. So that's the reasons why you need to engage lots of people. And as I say, workshops is one of the great ways to do it. There are other ways that you can run this. You can do an interview. Lots and lots of interviews with people, one-to-ones, and you probably want to do that anyway. So if you're developing a plan, you want to get out and talk to loads of people one-to-one. If you look at the WRAPT Redesign course, look at the future state workshop stuff, look at the facilitating a workshop, extra course. It explains that workshops are best done having interviewed a few people. So worth looking at that as well. Another thing that's worth doing is getting a survey out. You can get out to people and say, right, what are your top 10 issues? You can ask people, what are the top 10 solutions they'd like to see, or top 5 solutions they'd like to see. Getting a survey out to lots of people can also be a very powerful way of collecting data. And the reason why I like that is you're able to collect data which you can use. It's qualitative data, but you can show it quantitatively. So you can say, 50% of respondents said this was a problem, or whatever else. If I'm going to do surveys, I like to do a couple. So I like to do one which generates a general view on things. What do you think your main issues are? Then I like to synthesize that into a list of themed issues, not too many, and get that out to people again and say, to what extent do you think these are a problem? Because that way you get people's view around a known amount of things, whereas before you're just asking people what's top of their mind. But however you do those, surveys are worthwhile. So engagement, absolutely critical, and worth going back to the extra course on facilitating a workshop, etc. for this, because that will give you an agenda and everything else you might need to think about in terms of this. So engagement will get you a lot of qualitative data, and in some cases that's all you are going to get, because some places have got pretty poor data, or you can't get hold of the data, or whatever else. But I know I've worked in places where that's pretty much all we've been able to get, but it's still important to look for quantitative data. And there are 5 main reasons why you need to do that, which are set out in these beautiful blue boxes. First of all, you can test the hypotheses. So if somebody has said, "Ooh, cancer's the big problem, we've got to address cancer," then if we do data analysis around where the issues are, we might be able to say, well, look, the data says, you all think that qualitatively that cancer's the area where we've got the biggest problems, but actually we found it's mental health, for example, which has got the biggest problems, or whatever else. So, or you've all said that cancer is the biggest problem, but we found it's not a problem because of this, and this. In reality, you probably are going to find it lines up, because everywhere is a problem at the moment. But at least it helps to test the hypothesis and make sure it's not just someone who thinks there is, or some particularly key people that think there's a problem when there isn't. So it's to line things up with a qualitative. Second things, we might find new things. So we might have found that we had no engagement from in the workshops. We didn't have as much engagement from radiology as we would have liked, and suddenly we find that radiology is an area where we've got a huge age problem, or a huge demand versus capacity problem, or whatever else. So being able to do data analysis helps us to find new problems. I think aging is often one that doesn't always come up when we're talking to people. But then when you look at the data, you quite often see that a third of the workforce is going to retire in the next 10 years, sometimes more. And that is something which we need to address. When we did a recent plan, that was something that came out. So it helps you to find new things as well. It helps you to frame the discussion. So you can't run, you really shouldn't run a strategy on just on anecdote. When I say we shouldn't do it, obviously we do it all the time, but we shouldn't do it. So the key bit is to make sure that you are framing the discussion that you're having. So if qualitatively we're saying this is what the issue is, we need to be able to put some stats around it. So it's not just we all think, or a few people think that it's cancer is a problem because of this vacancy gap in CNSs, or this demand and capacity gap across the system. We also need to assess the benefits, so we need data to help us do that. If we haven't got that, then it's difficult to know that, and we also need to make sure we've got the detail that will be needed eventually. So, whenever somebody then gets into a proper bit of planning around cancer CNSs or whatever else, they'll need that data to help them to start that work, and they'll need that data to help them assess the benefits of the project. And in the plan, we need to make sure that we've got the benefits, and we will need steadily increasing amount of detail as we go through. So it's important to collect quantitative data. Now, we talk a bit about quantitative data again in the WRAPT Redesign course. It's well worth looking at that, because that talks about what we might collect. It talks about data requests and the do's and don'ts of data requests, and it talks about data analysis off the back of it. So again, worth going back to the WRAPT Redesign course to have a look at those elements again if you can. I guess one of the key things, though, that we like to do as part of gathering data is the document and good practice review. We talk about this in the WRAPT Redesign course, of course. We talk about using STAR as part of this, and we talk about using Tinternet to actually work out what is available or what information's available. But I think in a large-scale strategy or plan, it takes a whole new level. This comes to a whole new level, really. It's something that's very important when you start. And it's for four main reasons. First of all, it expands people's thinking. We really need to get people to think differently for a strategy and a plan. And if we can bring in an expert on digital, if we can bring in patient experts, if we can bring in somebody who's done this somewhere else before to really talk about what happens, then it really can expand people's thinking. We did a mental health study in Chorley a few years ago and brought in the AHSN at the time. I think it's the Northwest Coast AHSN. Brought in some digital experts, and it really made people think differently about how you might be able to engage with service users. So it's well worth doing. What it also does is bring in so that was a speaker that we brought in. But by doing reviews and understanding what else is out there, you can expand people's thinking. Issues and solutions from elsewhere provide confidence. It actually helps people to understand that we can do things differently. Benchmarking, I believe all benchmarks are evil because people tend to use them unthinkingly. But if you are able to get a view that say, oh well, in Bury or in Brighton or in Felixstowe they do things differently. I'm not sure why Felixstowe, but if they do things differently there and they get better results, well then that can give you a degree of confidence that these solutions can work elsewhere. It helps us understand what is going to change. So if we're able to do a proper good practice review, we're able to get data from elsewhere on what happened, then we can feed that into the benefits case. We can actually talk about the likely impacts that it will have. And it provides models for implementation. So, if we were to take that, all four of those together, we could look at an example and say, right, in another system, they use AI to do this. There's some experts there that can talk to us about how they did it, but we can see the impact it had, and this is how they implemented it. All of that stuff would be really useful to introduce the group to, because it helps with the engagement and it helps with the implementation, it helps with the business case. What I like to do for a document review is to talk to people in advance, like I said in WRAPT Redesign, and understand what things we should look at. I'd like to do searches on the internet. I like to look at STAR. If you don't know what STAR is, go back to the WRAPT Redesign course, but HEE STAR, you can search for it on the internet. It is a great tool for identifying the areas you need to focus on. It's a great planning and strategy tool, as well as, again, helping all the way through the process. So I like to get a list from talking to experts about what they think we should look at. I like to do a search on the internet. I like to look at STAR. And then once I've started looking into documents, you get all sorts of other documents to look at, and things grow from there. What I like to do is to create a table which lists out, a reference for each one, the title of each one, lift out the key findings, but also make sure we've got key view on the metadata. So who suggested it, what's the source, what's the date on it, etc. And then an embedded link. That way, if you do a large-scale good practice review and a document review, you've got an artifact at the end which lists out all of these things. And what I also like to do is to turn it into a paper. So I've recently been working on another mental health project with Health Education England and the CLEAR team, and we developed a paper of what are the top mental health workforce planning challenges, based on the document review and the interviews in that case, but based on the document review that we did. So it's worth looking at to give you something as an output from your project as well. So that is most of that stuff we've covered there has been about current state planning. What about future state planning? So let's have a look at a few of these things on this page here, and a lot to go through. First of all, there are kind of two types of plan a little bit when we're looking at things. You can have a full and detailed plan, as I talked about, which says this is where we currently are, and this, based on all the changes we're going to do, is the future state. So we already know we're going to do these 10 projects, and this is the impact we know these projects are going to have because we've already done the scoping, and so we're into implementation. And so we are going to have, we've started with 1,000 social workers, and we're going to end with 800 social workers and 200 support workers or whatever. We know all of that detail, and this is the project, and this is how we're going to get through it. We know the detail of exactly how we're going to intervene in recruitment, retention, that sort of thing. So it can be a really detailed full plan. But it can also be a plan to get to a plan that says, we have done this stuff, we want to get to this sort of stage, and these are the 10 projects that we've kicked off that we think are going to address it. Because that's all you've got to. You haven't done the rest of it yet, but you've still got to put a plan together. So again, it could be as simple as we've looked at where we are, we've looked at the context, we've looked at where we are, and the future state is we've kicked off these 10 projects, 5 projects, whatever, which we're going to go ahead with. But at the moment, we don't have the detail of exactly what impact they're going to have. The teams are working on those at the moment. But at least you've got a plan to get to a plan in that particular case, which I think is useful. It's useful because you can wave it at people who are saying, where's your plan? But you can also use it as a way of engaging activity, and it's the sort of edges of the jigsaw which you can steadily fill in as people complete their projects. So different types of plan that you have there. If you are picking those out, there's a few things to make sure that you need if you're going to have those sort of sub plans, as it were. There's a few things that you need for each one of those. For that plan, you need to have a name lead and resources that are going to help with it. And you need a pro forma for the team to complete, because you want every one of those plans to be the same if you can. There's a project charter that we use in the redesign section of this book, which works quite well. And then you are going to need to support the teams to come up with an outline plan. Okay, so if I go back, because I might not have explained it that well, if we've got 10 projects that we're going to move forward with, each one of those 10 projects in the strategy will need to have a name lead, a team to help them. You've provided them with a pro forma, and we are going to take them through a process to help them develop and to develop their project, the outline plan for their project, and record it in the pro forma. And what should be in an outline plan? Well, that's what's on the right hand side here. So if you to step back, if I'm going through a series of workshops, I would start the first workshop with a view on where we are, what we're trying to achieve, and by the end of the workshop have a prioritized list of issues and solutions to those issues. So hopefully by the end of it we've identified the 10 projects that we want to work on, or the 3 projects we want to work on if you're listening to Minto. And then we get into the second workshop, and what I want to do here is to use that time to get people to help the named lead in each case to come up with an outline project plan. Obviously a lot of this stuff will be done behind closed doors, but again the engagement is really, really helpful for all those reasons that we talked about. If you're going to get them to do this, you often use, one of the things I tend to use is kind of the World Cafe approach, where you have some of the workshop. If you've got 10 projects and you've got 100 people in the workshop, then you wouldn't want 100 people looking at each one after the other. What you might say to people is, right, over the next few hours we're going to work on, you're going to get a chance to work on 3, 4 or 5 of them, and you get them to move between the groups, constantly adding to whatever the previous group has put in terms of these topics. What are the topics? What are the areas you need to focus on? Well, you've got a description. You need a clear scope. Again, we talked about that in WRAPT Redesign. Where does it start? Where does it end? What's in scope? What's out of scope, etc. We need to know links and dependencies to other projects. So what's it going to, especially if there are ongoing projects in other areas. So, are we dependent on the EPR replacement or whatever? We need to know what resources are needed to deliver this. What are we going to need? Money, equipment, buildings, people. We ought to identify metrics that will help us to identify it. There's a separate course on metrics which is worth looking at to help think about what those metrics should be. We need to, absolutely key, know what work is already being done. So what projects are already underway that's going to help towards this this solution. If you're working in a system and you're coming up with a project which is going to operate across the system, you do not want to be doing it yourself. It comes back to the whole thing of we need more teeth. You're not going to want to deliver the whole thing yourself. You're going to want to make sure that you can pull in work that's already going on in trusts, in primary care, in local authorities, etc. So you need to know what work is already being done that you can fit within it, because this project might be a little more than coordinating all the little projects which are already delivering this stuff, and that's great. You need an overview Gantt chart plan for the redesign. What are we going to do by when? We need to know what benefits we're expecting to get from it, and that's going to be absolutely critical, because we need to add all these together and think, right, where do we think we're going to get to as far as the solution's concerned. And we need to agree fairly high level what the governance is going to be for this project, how often are we going to meet, that sort of thing, and who are we going to report to. So future state planning is an important part. It can be done at high level, and some of the resources that might be needed might be an approach to redesign, and you can point them in the direction of WRAPT Redesign as an approach to take. So I've been through quite a lot, but I am now ending on this horrendous slide with a slightly dodgy alignment at the top. I'm not quite sure what's happened with my text alignment there. But this is an overall approach that you could take to delivering a plan. So I'll spend a little bit of time on this. First of all, you mobilise the project. So going back to those circles, take all the steps you can, go back to WRAPT Redesign and understand how do you mobilise a project, get the right people in the room, get the right engagement, etc. If you are doing an ICS workforce redesign where you're going to bring in hundreds of people into workshops, then you better make sure you mobilise it properly up front and you've got all the resources you need and you understand the plan and everything else, otherwise it's going to be a nightmare. Secondly, you do some interviews of absolutely key people. First step, interview people, find out what they think are the key issues, find out what documents they think you should review, find out what they think the key areas of focus should be from the start, find out from them what they think is important in a plan, how quickly they want the plan, etc. So you can just link it back through to your governance. Key things here, though, are finding out what documents you need to review and what the key issues are. What you're able to do then is to do a good old document review based on that initial view of the issues, and we've covered what we need to do in a document review. And then you do some initial data analysis. So at this point, based on what you've got, you can do some initial work. What might that include? Well, that might include looking at key staff groups. It might include looking at the issues that have been raised in the interviews, etc. But it's some initial data analysis that you can provide. We quite often undertake what we call a baseline for a program, and I will ask the WRAPT team to go through a baseline on one of these courses to explain what they've done and where they've got it from. But it's normally fairly basic activity about where are staff based, where are service users based, what are our main sites, what is the key what's the key activity that we do, so the size of the activity, what's the size of our staff, how many people have we got, how many nurses have we got, how many social workers have we got, etc, 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 and any key data analysis around issues that we think might be there, like aging or a lack of alignment of demographics, vacancy analysis, that sort of thing, bank and agency analysis. All of this stuff's in the data courses that you can look at, one of the extra courses. Just pull that initial data analysis together and then develop a pre-workshop view from that data analysis, from the document review and from the interviews, to provide something in Workforce 1 where you can say, hey guys, we've done a bit of work and this is some initial stuff that we found. All right, so you're not just going into a workshop going, well, I don't know what we're doing, you tell us. We're going in with some stuff we can show them. At that first workshop, we present those views and people go, ooh, isn't that exciting? And it helps drive a view. What we also do is engage some patients and some experts. So maybe from the document review or from other bits of engagement. Always engage patients to explain what it's like currently, which is why we need to change. I always love to engage patients at this point, if we can get the right groups, as we discuss in previous courses. And engage experts in terms of, look, this can be done better. There's loads of stuff we can do. Look at the art of the possible. The whole way of engaging those experts. You can have them talking. You can actually run, marketplaces where experts are in the room, just showing what sort of stuff that can be done. There's all sorts of different things that you can do around that. What I then ask people to do is to do a PEST or PESTLE analysis or issues analysis to identify what the key issues are. Always worth also thinking about what the key strengths are as well as we go through. As I've often said, make sure you've got the strengths out so that we know what we're not going to throw the baby out with the bathwater when we change things. And then get them to do some priority setting, the really identifying what are the key priorities that we want to do. And then you can do some group solution planning at the end around that as well, in terms of let's describe those priorities in a bit more data. Let's think about what data is needed. Let's think about what the solution might be. Let's think about who would be best to be involved in that, but not come to a decision on that. So we can say, through that workshop, we can say, right, well, we've identified that our priorities are cancer, our priorities are making this place a great place to live, to work, sorry. We're going to focus on staff recruitment or whatever. Let's go into a bit more detail on what we mean by those things, and what data we need for it, and who might best be included. As I say, not come to a decision. Let's not at the end of a first workshop ask people for volunteers or ask people to say who do we think should be there, because that will really reduce the energy and wreck the Hollywood arc, as we have talked about in previous courses. Once you've done that first workshop, you go back to your steering group and have a check and say, hey guys, this is where we're up to, what do we think? We agree the solution areas based on that workshop, which you can do just based on a workshop, based on a discussion with the steering group, or we could engage people with surveys or whatever else if we need to, depending how long we've got. Then what we need to do is agree a lead for each of those areas. So, and when I say agree a lead, that doesn't mean assign a lead. It means sit down with someone and say, hey guys, you've got a great opportunity here, opportunity to work hard to help us with, you're going to lead on the cancer work stream, and get their agreement that they are going to lead on that. Once you've done that, you can then move into much deeper data analysis, because we know what we're looking at now and we can do some much more. So the second round of data analysis can be done to really help describe those problems in more detail. What we then do is move to a second workshop where we are set out the issues that we found. Again, set out the issues and set out the themes that we found. We engage the patients and the experts again at that point to get people to think of things differently. We introduce the leads for each of the areas in a kind of a Mortal Kombat kind of a way, get them to stand up at the front and say, right, I'm the lead for this, I'm the lead for that. And then we move into group work in the workshops, as I described, where we go through all of those different steps there to say, right, okay, what are the elements that we need for the future state? Once you've done that, you can do some final data analysis and final work, anything that's needed off the back of that, final analysis on metrics and all that sort of stuff. You then develop that plan by theme, which is a small box but a lot of work. You then document the plan, which we'll talk about next time, and then you validate and communicate that plan. You validate it with the steering group, you validate it with an audience, and you communicate it out to everybody, and everyone then gets on with it, and we deliver the plan, and we move into the sunlit uplands of a redesigned ICS. So that's it, really. That's how one goes about developing a WRAPT plan. Well, that's how I go about developing it. I've done it a few times, and most of the time it's gone pretty well, actually. I do like pulling together high-level workforce plans and strategies because they are quite an engaging process. And you often find loads of interesting stuff. They're also not quite as hard work as I've probably said before, my least favourite part of doing this stuff often is the redesign workshops in Redesign, because you've got to get people to agree to changing power structures and changing their jobs. In this particular case, it's a bit early for that, so you've got all of the fun stuff of Redesign without any of the horrible stuff. So thoroughly enjoy it, and it's well worth getting into. Next steps, feel free to register to the WRAPT tool, buy the bumper book of Health and Care Workforce Planning. I'm recording this at the end of June. The book has been through its final edits. It should be on Amazon by end of June, possibly first week in July, depending on whether the print copies that we're getting are any good, but includes a lot of detail includes a lot of this stuff we've talked about here. You can visit the WRAPT website, you can visit the Health Education England website, workforce planning pages, or access STAR, search for HEE STAR, or you can visit my website www.carados.com, which I must update with all of this stuff. Next sessions, going through that, it's interesting. If you haven't done the WRAPT Redesign course, do the WRAPT Redesign course, because it's important. Continue the WRAPT Plan course, with session 2, what a plan looks like, and I would also do the WRAPT Hub course, which I'll record in a minute, just so you understand what a hub looks like, because that will help you with your governance when it comes to the session 2 of the WRAPT plan. And finally, if you're interested in frontline stuff, do the WRAPT Frontline course when it's up. That will help you to identify the skills that are needed and a project that can be used to help you to think through how do you really get skills updated in your frontline staff. Hope you've enjoyed that. Thanks for your time. I'll see you next time on session 2, continuing the WRAPT plan course.